question answer session, case discussion. I have a case also to discuss. If the first let people join, and I always say do join early so that we can start the case or discussion very fast. There are 2-3 cases on WhatsApp, so I'll start those if there are no questions on the YouTube live. So first question, let everybody join first. So one question was there regarding usage of rubric. Good afternoon, Dr. Meera. So there was one important question where the patient had basically operated for a ear disorder, acute suppurative otitis media, and after that operation, he had developed a lot of adhesions in the middle ear. So in that case, they were prescribed a lot of medicines, and it was not giving good results. So the case came to me, and of course, if this is the case where the adhesions are there after operations, syphilitic, psychosyphilitic miasm, so you have to make sure that you understand what the case is, and by just giving a dose of thiocyanaminium 33 times a day for 2 days, the patient reacted very well with the medicine, and gradually he started improving. So sometimes what happens, the particular symptom of a particular case is so important at that time. That is more important to understand what is the symptom at that surface miasm. So one question, after slightest change of weather or stress, patient starts epistaxis. Yes, so I think this question was asked that I think in previous webinar, if I can remember, but slightest change causes epistaxis. Now, if you go by the symptomatic wise or repertory wise, it will be not general like only epistaxis. We have to take a generalized rubric. Change of weather aggravates. So in these conditions, there are two things: either change of weather aggravates or change of position aggravates. So you have typically asked Dr. Meera, change of weather aggravates. So in this case, or aggravates epistaxis. So in this case, Dr. Meera, you'll be very happy and surprised to know you have a remedy, a bleeding remedy, a very important remedy which is indicated for bleeding disorder, and that is phosphorus. The remedies that you should think about, do write in your paper. That first is phosphorus, second is sorinum, third is arsenic album, fourth is silesia, and the fifth is rustox. These 5 remedies are very, very important whenever the change of weather aggravates the complaints, including epistaxis. So in your case, just see the constitution, just see some symptoms, and you can prescribe one of the 5 remedies. That should work in almost all number of cases. There are few remedies apart from this, that is gelsemium is there. In some cases, you can think about other remedies, like one rare remedy that you should think about in this case is gelsemium. Second remedy you should think about in this case is rhododendron. And third remedy that you should think about is dulcamara. Of course, dulcamara is basically needed for dampness and change of weather, and then patient is developing asthma or respiratory disorders. So this is how you have to repertorize the case and how you can get to the remedy. So got from Dr. Samreen, Dr. Alexandra. Phosphorus, a very, very important remedy, and of course in phosphorus you have to remember its indication and the constitution. By the time somebody asks me another question, I'll just tell you phosphorus, it is indicated for tall, slender persons of sanguine temperament. Sanguine temperament. The skin is fair, the eyelashes are delicate, blonde is there or red hairs are there. Important is that in phosphorus, quick in perception, and very sensitive nature. Very sensitive nature. This is very, very important in phosphorus. Apart from all the symptoms what you know about phosphorus, but this very sensitive nature of phosphorus is a very important prescribing symptom. In fact, it is written in a Lenski note, not sensitive, oversensitive to all the senses, to all the external impressions, light, noise, odor, touch, everything the patient is oversensitiveness. So this is very, very important. Okay, I hope you got the case. Hello, Dr. Babel. Infertility in homeopathy, please detail. Now, a case of infertility. First of all, you have to understand infertility if you're treating it is male or female. Male infertility, whether the sperm count is less, more, depending whether the sperm count is less or the sperm count is normal, but the morphology is a problem. The sperms are not normal, the sperms are dead. It's a different matter. In females, do think about ovulation not proper, anovulatory cycle, anti-mullin antibodies is low, prolactin is high, PCOD, or adhesions in the eustachian tube. There are a lot of causes. So it is not a sure shot like if I can tell you that try this medicines or try this medicines. So you have to exactly find the cause and then take the whole case and then prescribe symptoms. In most of the cases of infertility which I have cured, basically I have mostly prescribed on constitutional medicines. In male infertility, it's very important to understand that varicocele also is sometimes responsible for low sperm count. In fact, I'll go one step further, that is, if the patient is going for in vitro fertilization or test tube baby, in that also you can help the patient so that the sperm and ovum mating is very well and it does not cause abortion. The uterine bed is very favorable to the fetus. We can create that with our homeopathy medicines with constitutional and miasmatic prescribing. So in both the cases, we can definitely help the patient. Okay. So good afternoon, Dr. Singh. Uh, Anti-mullin, yeah. If anti-mullin is low, in this case, most of the time I've seen a very constitutional medicine prescribed mainly by case taking, especially in females. I've seen lot depends on the stress factor and how does that female react to stress. This is a very, very important thing. The reaction of that lady to stress, if you can understand the reaction very well or very properly, then you'll be able to prescribe a very, very suitable simillimum to that patient. Lady 31 years trying for pregnancy since 3 years, history of irregular menses. She had piles, was cured by our medicines, chinim ars. Now, should I repeat the same? Now, make sure that the lady basically, if Chinimas has cured some complaints, that means if acute complaints you have cured with Chinimas, that means the lady is lying the constitutional medicine. If it is not Chinimas, by the whole case taking, the medicine, the constitutional medicine lies in between the Chinimas, either China or arsenic or arsulflamum or other remedies very close to China's. So it is not always that the acute remedy is the chronic remedy, though sometimes it is. But in this case, if you take the history and not including the symptoms of acute disease, only symptoms of the patient's constitution, and if that also suits the patient, and that in that case also you feel that China's is indicated, then China Ars is the constitutional medicines of that patient. Okay. Okay. Thank you, Dr. Patel. आपसे कंसल्ट कैसे करना? Yeah, you can. Of course, you are competent enough to understand. You try to prescribe the case. You try to prescribe the remedy. Still, if you have some difficulty, I can guide you. You can send me the whole case on WhatsApp, and then we can discuss. Okay. Rheumatic arthritis pain better by warmth and aggravated in summer. Now, see what happens in arthritis. Most important thing, if the pain is better by warm, in lots of cases you will see that the pain is better by warmth. So if the pain is better by warmth, to whether to prescribe or not to prescribe, that depends upon the intensity of amelioration the patient is. For example, if the patient generally is better by warmth in case of arthritis, you have to think about 2-3 remedies. The first one is arsenic, second one is silicea, third one is rustox, fourth is bryonia. This is important. But I have seen in these cases, just by the simple modality better by warm, only temporarily the patient might feel better, and again the patient will have the same symptom. But now if you see summer, now summer aggravates, or you have classically written that in summer the patient has complaints increases. Now this is a very very important. Now if you club both the symptoms, that summer is the patient is better in summer and better by warmth. So if you repetize these two, one remedy that will come is Bryony alba. In Bryony, it covers both the thing. But rheumatic pain in summer or rheumatic pain in warm weather, the first remedy that you should think about is colchicum. The second remedy you should think about is Kali bicrocum. Kali bicrom. These two remedies are very, very important where the patient says that the rheumatic pain is mostly in the warm weather. But if you club both the symptoms, there only one remedy in your repertory chart, and that is Bryony alba. Okay, I hope I could answer this question very precisely. नेक्स्ट क्वेश्चन इज सर 4 months की बेटी है, उसे 3 months से सर्दी है, डिस्चार्ज कुछ नहीं होता है, रात में नोज ब्लॉक हो जाता है, नाक से खर खर की आवाज आती है. नाउ व्हाट हैपेंस दैट if the patient has simple sardi hai and it is a soric symptom, in case of children, in case of children, now in case of child, the patient has having coryza, there are lots and lots of medicine. In this case, simple, you have to first see how is the coryza and how is that coryza disturbing the child. That will be a 3 marking and a prescribing symptom in your case. Okay, just by coryza I think will not get the remedy. If you go further in children's, it is very the problem in children's would be, firstly we'll differentiate in newborns and then in children's. Newborns will not come in 4 years, but in newborns the remedy is chamomilla and Sambucus nigra. In children's, you have to remember few remedies which are very very important, and that is, first is ammonium carb, second is calcarea carb, third is heparsol, fourth is Sambucus, and the fifth is sulfur. Of course, these are general remedies, but you have to see how does that coryza is affecting the child. Is the child becoming very irritable? Is the coryza very acrid? Is the coryza causing itching? Is the coryza causing redness of nose? Then that becomes a very important prescribing symptoms in a child. Of course, you can also have coryza with snuffles. In that case, do think about ammonium carb, heparsol, Naxomica, and Sambucus nigra. Very, very important remedies. So I have given you 3 aspects in newborns, in children, and with snuffles. So do think about in this remedies, and you will crack the case. After chikungunya, female suffered by joint pain with swelling all over joint. Please prescribe. So you have to prescribe. I'll tell you the way to think and which rubric to take. So go in the chapter of generalities and see pain or after inflammatory disease. After inflammatory disease, still the pain remains. You have to think at that angle, and then you'll be able to prescribe the remedies. Okay? Plica fold patient has suggestion for surgery. Aggravation, getting up, sitting, bandage, stretch, knee like blockage in one place, aggravation, tired, hardening, climbing stairs, same, rest by jogging possible. Dr. Babel, I don't know, actually I can understand the question, but whatever I've understood, that is the patient has, I think, sitting aggravation. Okay, so in this cases what happens, whenever the patient is sitting, see, and there is pain, now sitting aggravates and Bryony and calcarea comes. Okay, so sitting aggravates. Now I'll go one step further. In this case, of course, Bryony will come, definitely calcarea will come, but do think about 3-4 remedies which immediately come to my mind. And the first remedy you should think about is zinc, phosphorus. Second is zincum metallicum. And sometimes, the patient is not phosphorus and the patient is not zincum. The patient becomes zincum phos. Fourth remedy, pulsatilla. And the fifth remedy, don't forget rustox. These 4-5 remedies are very important. And if nobody has tried zincum phos in arthritis or in pains, aggravation by sitting, you must think about the remedy. It is a fantastic remedy, zincum phos. Sometimes the patient is not zincum metallicum, sometimes the patient is not phosphorus, and it is the combination of zincum phosphorus, and that is zincum phos. And the most important thing, symptom that you must think about zincum phosphoricum is formication all over the body. This is a very, very important symptom of zincum phos, and this remedy is indicated in case of mental depression, in case of fatigue, in case of brain fags of businessmen. Like for instance, we have remedies like picric acid for businessmen, for teachers, for researchers. The same way, zincum phos is a very important remedy for mental depression or fatigue or brain fag of businessmen. But the symptom is nervousness and formication all over the body. Do think about zincum phosphoricum because it covers the trembling, it covers the twisting, and it covers the weakness also. Both weakness, mental and physical. Okay. Very good afternoon, Dr. Weber. Very thirsty patient with frequent urination, craves cold things, not diabetic. Very thirsty patient. Simple as that. For that, you have to understand. Phosphorus, very good, Dr. Weber. Dr. Weber, very good. Do think about phosphorus also. But my suggestion would be, in this case, whatever I understand, your patient needs zincum phos. Next question, thirsty, desires for cold, and what is the other symptom? Patient not diabetic and craving for cold. So now it is very important that we have a remedy which is what we call a thirsty patient and the patient craves for cold. Very simple. This remedy, your case should consider zincum phos. Yes. So sometimes what happens, Dr. Babel, you can. I always say to my students, if you read the life and letters of book of Hahnemann, it is written that you have to carry the spirit of Hahnemann with you. Everything starts working. It's like that. So the question to be answered for Dr. Patel is, do think about Bryonia alba, do think about calcarea sulf, do think about natrium mure, and do think about arsenic iode. These 4 remedies are very front-line remedies, of course. Then you can have remedies like opium, chamomile argentum, nitricum, borax, carbohydrate, lot many remedies. But these 4 remedies suits your case very well. Okay. सर मुझे 20 साल से लगातार सर्दी है और साथ में एक्जिमा भी प्राइवेट पार्ट्स में है, जो नाइट में इचिंग बढ़ जाती है, ठंडी बताइए. Now 20 years, Dr. Alam, if you have got coryza, it's very important to have a constant prescribing. You have to think about few remedies that comes to my mind: tuberculinum, sulfur, natrium mure, calcarea carb, arsenic sulflavum, and one remedy again, iodine. Of course, it's all a chronic, all are polychrist. So whenever you start these medicines in potencies, wait, don't repeat. That is my suggestion to you. Okay. And if possible, do use LM potency, that is 50 millisol potency. Natrium, actually, बहुत remedies. I told you natrium mure is there, bryonia is there, calcareous sulfur is there, arsenic iode is there, nitricum is there, sulfur is there, carbohydrate is there. But these 4-5 remedies which I have seen in my practice basically will have good results with you. Okay. Then you can qualify the thirst. कि thirst कब ज़्यादा है, thirst सवेरे ज़्यादा है, दोपहर को ज़्यादा है, रात को ज़्यादा है. That also you have to differentiate. It's a very intriguing science, and you have to go in the depth of asking a very small symptom. Just go in depth, just define the thirst, and you can get the remedy. Okay. Patient complains of intense headache, heat after exercise, feels like blacking out. Uh, I don't know who is there. I can't get the name, but I have told you one thing. Intense heat after exercise or intense headache after exercise, intense body ache after exercise. You have to get that symptom, no? So heat after exercise. Patient says exercise or physical exercise or heavy exercise aggravates the complaints. I told you sulfur iodide, I told you thyroidinum, I told you sulfur, I told you arnica. There are a lot many of remedies, So try to get the broader aspect of the picture of the disease. Just by knowing one thing, heat because of exercise, that can taken sometimes as normal also. Just take the rubric exercise, violent exercise aggravates. There's a rubric, there's a symptom, and lot of remedies. Case of SIBO with very big distension of abdomen starts immediately after waking, aggravation by drinking or eating, no pain but heaviness and tiredness. Dr. Alexander, SIBO I did not get, SIBO. What is the meaning of SIBO? What is the remedy for SIBO? What is SIBO? You can small intestinal bacterial overgrowth, that is SIBO. As we say in the medical science that small intestinal bacterial overgrowth, that is SIBO for me. Is it that? Yeah, okay. So it is that only. So what happens that basically there is bacterial overgrowth, out of control growth. Okay, so it comes in the miasm, classical psychotic, fulminant psychotic miasm, that is overgrowth, over. Now the next symptom is distension of abdomen. Okay, immediately after waking. Now this is important. This is important, because after waking, you should feel normal, and after some exercise maybe you have some problem, but this is a very very important symptom that after waking she gets the problem. Now you have to differentiate whether waking in the morning, waking in sleep, after sleep, that can be evening, that can be night, that can be anything. So you have to first identify whether it is waking or it is morning. That is important. There are few remedies which are very important and very useful in these conditions. Waking. You wake up and you starts getting symptom. So you can think about remedies. Like now, these remedies which I have used in my practice are very rare, but I have seen good results. The remedies Tila, Ptelea, Tila. Okay, and the second remedy that is again good afternoon, Dr. Vishaka, Dr. Smith. I'll just come to. So you have to remember the remedy Tila. It has a very good results, Tila. As you go further and the patient tells you no, it is basically in the morning, and that is again a very important symptom, and it is painless. So if it is in the morning, then there are very important remedies that should come to your mind, and the first remedy that should come to your mind in the morning is chamomilla, sulfur, nux vomica. Chamomilla, sulfur, nux vomica. And one remedy again that is again very rare, but I have used in my practice, and that is Cornus circinata. Cornus, Cornus, circinata, Circinata. Okay, so use this medicine. I have got good results, and of course, as I always say, nothing shortcut but a good case taking is always important. Okay. Hello, sir. In remedies G6 deficiency, patient having complaints of fever with thirst, hemoglobinuria, and methylglobin. Now, I have cases of G6PD deficiency with these symptoms. Now, I have seen in a practice that with my remedy, the patient is absolutely healthy, absolutely normal, no symptoms of G6PD, but still the G6PD is coming positive in that case. So, I would say I have good symptoms, but still that disease is still there in the body. Like for example, in case of hemoglobinopathies like sickle cell, like thalassemia, I have patients where the blood transfusion has been averted. If the blood transfusion was weekly once or twice, now he has now taken blood transfusion once in 2 months or once in 3 months. But still the transfusion is there. Still the report shows that sickle or thalassemia, but the patient's condition is much better. So in this case also, G6PD, that means Dr. Vaibhav, you have to do case taking of the mother emotions during pregnancy. First thing. Second thing, what does the disease say? G6PD deficiency. In this case, in almost most of the cases I have seen some deficiency in the patient's mind, which the patient wanted to do but could not do, maybe before pregnancy also, and during pregnancy. That thought has percolated too much in the patient's mind, and it has now percolated in the fetus, and that deficiency has come to the patient. That can be that disease could be anything XYZ, but the deficiency word in this case is so important. I hope you are understanding what I mean to say. Dr. Vaibhav, please do understand this. Please do understand this. Yes. Okay. Now, okay, I was just going on and on. So he has written admitted in the ICU. Hemoglobinuria and methylglobinuria. Now in this case, you have to first see why the patient has landed in the ICU and what was the thought process at that time which has landed the patient in the ICU. For example, if I tell you, when the patient comes to me and the patient says the patient suddenly collapsed, I ask the thought process before the collapse. Some patients say that I was just thinking that I have to pay so much. Some patients say I have to marry my daughter. Some patients say I have to go there. What will happen? And suddenly, with that process, the patient collapses and he has bleeding and he has hemorrhage. And normally we give arsenic XYZ. But normally I ask the thought process before the disease originates, and then you will be able to prescribe in this type of cases. But still, if you want me to answer this in acute case, I have seen 2-3 remedies very, very important, Dr. Weber. First, try to prescribe or try to think about remedy Merck cyanide. Merck cyanide, Kali cyanide are very, very important remedies that I have seen in my practice. And third remedy which I'll tell you I've used is arsenic brome. Of course, then try to differentiate some symptoms and get the patient out of the ICU, and then think about the deficiency part during pregnancy which the mother thought has been percolated in the fetus, and you'll be able to get beautiful results in this case of G6PD deficiency. I have always used in my practice and I have got good results. Okay. Sorry, there are a lot of questions which have been gone through. I was answering this question because it's an important question and everybody gets to learn from this. That's why I was explaining more. So Dr. Smith says, dear sir, would you treat shingles from COVID vaccination, conventional or with COVID nosode? Dr. Smith, simple as that. Not with COVID nosode, because I have never treated. I have not seen case of a shingle after COVID nosode. But let me tell you, today only I got a fantastic case post-COVID. After COVID, the patient suffered from lot of falling of hairs. I had prescribed that patient COVID-19 nosode just as a random prescription and not the basic remedies like carbo-veg or we have lubrics. Today only the patient came to me and said, in 7 days I am completely better. So this is my experience, what I am treating now. And I have sent some COVID nosodes to a few doctors. You also try in your practice and give me good feedback that how the medicine is working. Because see, I am working according to my capacity. If we work together and if we get some good answers regarding a nosode, use of nosode in homeopathy, and we have got a good chance in form of corona, we can definitely, because see, a lot of cases are coming now of heart attacks, of high cholesterol, of brain fag, of loss of memory, of indigestion, IBS after COVID, So whether this COVID nosode works we have to combine work together and then we can get good answers. Of course, that is my thought. That's why I've sent the medicines. You try in your practice and do give me the feedback. This was the feedback I got today from the patient of simple falling of hairs. Okay. Good afternoon, Dr. Vishaka. I hope I could answer the question, Dr. Anja Schmidt. Color of urine is Coca-Cola color. Now, see, Doctor, who is the Dr. Coco? Okay, now sorry, Dr. Weber is only writing. So the urine color. See, Dr. Weber. Now, if the urine is Coca-Cola, now this is a very important symptom. You know, this is in homeopathy. I have never read that the urine is Coca-Cola color, but we have, Dr. Weber, urine coffee-like, and that color of coffee-like matches with the Coca-Cola color. First. Second, we have urine brown. That also matches with Coca-Cola color. Now, if I take urine coffee-like, the remedies again, Kali nitricum, lacasis, natramur. If you take urine, don't take dark color because that can be black also. If you take urine brown, in that also Ars brom is there. In that also Merck core is there. And Merck cyanide is also there. Merck cyanide also, Dr. Weber. So it is now coming out to be a beautiful case taking and a beautiful case. Do tell us which remedy you prescribed and how did the patient react. Okay, so this is what I can answer a question, because I've seen cases where the urine was like Coca-Cola. The patient says, but then I've used this what you call synonym coffee-like and brown urine, and the remedies like this which I've used in my practice. Very nice question, and I hope we get this patient out of the ICU and treat this G6PD. Sorry, a lot of questions have passed. I'll just see what is in front of me. Good afternoon, Dr. Deepak. Medicine for dandruff of scalp with severe itching, Dr. Ansari. Simple. Again, first find out whether it is dandruff or seborrheic dermatitis or psoriasis. And remedy that should come to your mind, Vinca minor. If you don't understand anything, Vinca minor. If you read Vinca minor, it has lots and lots of symptoms. Vinca minor. Of course, then you have phosphorus, you have calcareas, you have lots of remedies, but Vinca minor, do think about Vinca minor, because unless the disease is diagnosed, it will be very difficult to answer the question whether the disease is psoric, psychotic or syphilitic. Do think about Vinca minor, a very important remedy. I'll tell you something about Vinca minor, that in Vinca minor, spots of scalp oozing, foul moisture, matting of hair. It is a very important remedy for plica polonica. Hair falls out and is replaced by gray hairs. That is Vinca minor. Of course, think about phosphorus also. Very important remedy. Okay, and then you can have so many remedies for dandruff, But these are the remedies which I've used in my practice. Vinca minor, phosphorus. Then you can have remedies like natramur. You can have remedies like cantharis also. Cantharis, itching. Profuse dandruff, you must think also about sanicula, and then you have to differentiate the dandruff, whether it is white or yellow. Yellow dandruff, believe me, most of the cases will come out with Kali sulf. If the dandruff is white, lots of cases will come out with natramur, thuja, and phosphorus. Whatever mathematic I can tell you extemp, okay? And one patient was there which has typical dandruff in the occiput, sirf piche. In that case, think about sepia and natramur. I hope, doctor, I could answer your question. I am using Dr. Anja 30 potency. COVID nosode I am giving for cases of COVID nosodes. I am exactly COVID symptom. TDS for 3 days and prophylactic BD for 2 days. But in that case, which I told you about hair fall, I gave only 2 doses, only 1 day. Hydrosalpinix debris in left fallopian tube. What are the remedies you think? Hydrosalpinix debris in there. Now, whatever comes to my mind, you have to think about silicia. The first remedy, you always think about silicia, because to take out the whatever foreign material is there in the body. Do think about calcarea floor. Do think about nitric acid. Do think about phosphorus, and do think about thiosinaminium. Hello, sir. I am stuck in a chronic case. It was a case of depression, but whatever I gave her itching increases which doesn't exist before. See, that means, Dr. Muzammil, see, every time itching comes, it is not Herring's law of cure. Now, in this case, Dr. Muzammil, just do some reading of Kent's 12 observation. You have to read Kent's 12 observation. Once you read Kent's observation, you will automatically understand what are you lacking. Is the remedy touching the core, not touching the core? It is a change the remedy or not change the remedy. You will get the answer. So, my dear doctor, you do study Kent's 12 observation, and still, if you find there's a problem, you can get back to me. Dr. Webov, thank you so much, and do keep posted for this case. If not in YouTube, at least in private chat. Okay, it's an interesting case. Dr. Monday says, nap of neck, pain from slight exertion, cannot even carry tiffin box. Whenever there is this symptom, do think about 3-4 remedies which are very useful in this case. The first you should think about is semesifuga. Second, do think about matfos. Do think about rustox, and think about guaiacum. Remedy for incomplete abortion. Think about sickle core. Think about sepia. Think about semesifuga. Potency of COVID nosode, I give 30 potency. Girl rates, I hope I could get the name of this doctor because he has written something else, but still get it. Girl having right maxillary sinus, swelling, not going even after steam inhalation. See, what are the important symptom? The patient has told you, doctor, not better by steam inhalation. So this is the symptom. The patient is not better by dry heat. Go to the repertory, go to the Matermedica, and see no symptom or obstruction of nose or blockage of nose, not better or aggravated by steam inhalation. That is dry heat. Prescribe the remedy. Okay? Do some reading. Dr. Deepak says, sir, please share Calcarea renalis medicine. Means you want to know something about the medicine, Matermedica about Calcarea renalis? If I can get what I don't know, Calcarea renalis, you can procure from any pharmacy. If you're telling basically you want to get the remedy. Matermedica wise, Calcarea renalis, I have used once or twice, but my understanding of Calcarea renalis would be not so good. Like I've not used that remedy very frequently. So symptomatically, I can tell you I'd used for some time renal pains and all in some remedies, but not satisfactory results. So I can tell you something about the Matermedica. What I can't tell you, I can't tell you. I have not used that remedy in my practice. Calcarea renalis, no, I have not used that. I have not made that also, so I cannot comment on that. Please explain something about the selection of dose of medicine and potency. Yeah, so whenever, see, it's a basic law in homeopathy that you have to follow, that when you're prescribing on mental symptoms and all, use a high potency, and in cases where the pathology has a lot of pathology is there, so go with the low potencies. And to start a case, or if you basically are not sure about the potency, medium potency should help you. Good afternoon, Dr. Madan. You have joined in very late. Dr. Shoaib says abdominal pain more than 4 months after pregnancy. Pregnancy to normal CT shows abdomen with mesenteric lymph nodes. Yeah, interesting case. So after pregnancy, do you have some more modalities or more symptoms, Dr. Shoaib? See, because the mesenteric lymph nodes are enlarged and the patient has a problem. So I have to know something more about the case, so that simple if simple if if I tell you something like, okay, pain after pregnancy, write the remedies. You can see write the remedies like graphitis, arnica, chamomilla, sabina, pulsatilla, semesifuga, lot of remedies. But if you are more specific, and then I can answer you more specific something, Like for instance, there is pain. So type of pain, it is soreness, it is cramping, it is constriction. So there are a lot of other things. So if you can give me the modality, otherwise these are the remedies which I use in my practice after pregnancy, long continued pain, graphitis is there, chamomilla is there, and whatever remedy I have to use. So if you are asking me something specific, I can give you a specific remedy also. molluscum contagiosum. Dr. Weber, see, very useful remedies, very important remedies. Do think about thuja, think about silicia, think about tellurium, think about calcarea carb, and think about, I have used in my practices, natramur and tellurium. These 5-6 remedies will give you fantastic results. Fantastic results. Which I have used, I have given, and I have seen results. Absolutely, what I've seen in my practice. Okay. In okay, this is so, Dr. Shoaib. If still, so then you can think about Naxomica, Pulsatilla, Sepia, Creosote, Calica, Chamomilla, lots of remedies. Then differentiate the pain, differentiate the site of pain, or sometimes what happens, Dr. Shoaib, it is written in one of the remedies. Now, I will ask you a question. After abdominal surgery or delivery or lithotomy or ovectomy, or after some sharp cutting instrument, there is pain in the abdomen or XYZ in the abdomen, which remedy should come to your mind? Anybody? Anybody? Calcarea flow. Okay. Anything you can add on to remedy which I have told you the symptom? Stephysagria. Very nice. Stephysagria. It's a very important step. Yeah, everybody is. Bellisper is also there, but okay. But whatever symptoms I have told, basically it is written in Stephysagria. Now, Bellisper is also there, Staphy. Everybody is so right. So think about these remedies. Whatever symptoms the patient. I was basically teaching this Stephysagria in one of the workshops of Mater Medica to a college level. And I was explaining Stephysagria, how to get the symptoms of Stephysagria, and I showed some cases of Stephysagria which were so interesting. In that case, in that remedy, I had shown a case of pain after pregnancy not going for a long time, and then we prescribed Stephysagria, 200 single dose, and the pain vanished. So I was just telling you that. Yeah, Dr. Mozambique, do read something about. Yeah, Bellisper is also there. Bellisper is also there. In Bellisper, it is basically injury to tissues. When there is injury to deep-sided tissues, deep tissue injury, in Bellisper is there. Of course, it is there. But I was talking staph because I have just taught Stephysagria just 2 days back only in the Mater Medica workshop. Yeah, so do a lot of questions have scrolled up. So if I've forgotten sometimes, you can keep writing and I will check again. Yeah, Bellisper is there. So can we move forward? Some other questions? Lot of questions I have missed, so you can always again write the questions and be fast. We are already 45 minutes up. Scope of homeopathy in pulmonary tuberculosis. See what happens. I can't tell you scope. Homeopathy has a lot of scope in all diseases because, by the grace of God, I'm able to cure lots of diseases and practically have given me good results. What happens in case of pulmonary tuberculosis? If anybody is an MBBS doctor in webinar, now tuberculosis has now been a disease where you have to go to the hospitals and tell that you have tuberculosis patient, and you have to find and you have to follow a protocol. So even if you're treating a case of tuberculosis and if it's okay, it's okay. But if the government comes to know that you have not reported that case, then there's a problem. So it is very important that you have to report this case and the patient basically has to take those anti-TB treatment. I have 2 cases. One case is following up in my Bombay clinic and he's doing very well. But let me add to this that he's already taking that anti-TB medicines. He's already taking anti-TB medicines and he was not better with that, and with our homeopathy medicines, the patient is responding very well to treatment. So, homeopathy does have a good scope in case of pulmonary tuberculosis. But my request would be you have to report this case because it is now important that you report this case because TB has to go from the world. That's why the PSM department, basically what we have studied, has made it mandatory to report the case of pulmonary tuberculosis. 18-year girl suffers with leukorrhea since 5 years. Now, see, Dr. Deepak, it's a very huge area of remedy which will come, leukorrhea, and you can you can basically take a symptom where it is written in a mathematica that the leukorrhea is very chronic and the leukorrhea is constant. Leukorrhea is chronic and the leukorrhea is constant. The patient has leukorrhea since years. In this case, if I have to give a blind answer, you can write down this remedy. The remedy is cinnamonium. Cinnamon, I don't know, it is basically used in our kitchen also, no? Cinnamonium. It's a very interesting remedy where I've seen the leukorrhea is always chronic and always constant. So we have cinnamonium, we have graphitis, we have sepia, we have borax, we have lachesis, lot of remedies. But in your case, do think about these 5-6 remedies. The first remedy is cinnamonium. Stools immediately after eating. Make sure that you see that the patient is not suffering from irritable bowel syndrome, Immediately after, मतलब टेबल पे पेशेंट खाना खाता है और लेटरिन भागता है. Do think about ferrum metallicum, a very interesting remedy. Allium cepa in cutting injury to nerve. Okay. Remedies that have a sensation of foreign body in abdomen. Now, sensation of foreign body, or you can say, I'll just, Dr. Alexandra, I'll just turn the question. Sensation of something alive in the abdomen. Do you get me? Just change it. Are you with me? Sensation of something alive in the abdomen. And then we have a lot of remedies. Then you can think about Crocus sativa, Thuja, Cyclamen, Natrum carp, Calcarea fos. So this is how you have to basically understand and then prescribe. Okay. I hope you got the answer. If not, then there are other remedies also. But you can think at that angle, and then you can basically prescribe the remedies. So immediately go to some other question. Discharge, acrid, corrosive. You can think about creosote. You can think about arsenic. A lot of remedies. Okay, cinnamonium. You can this. In cinnamonium also there is discharge very acrid. Patient 16 years. Menorrhagia, left ovary was twisted with operated, right ovary increased in size. Father died when she was 5 years old. She's feeling why all wrong things happened to me. You can take a rubric called feeling unfortunate and then proceed to the case. Male patient, obstruction of nose, night sleep during respiration difficult causes nose sleep, head high to avoid respiration, nose blocked. Yeah, simple, simple you can say basically, Dr. Madan, obstruction of nose, obstruction of nose and especially at night. And then you can add, because of that, the patient has to wake up. So remedies you should think about is magnesium carb, phytolica, sticta, and ammonium carb. Simple. Guillain-Barré syndrome. I have only 2 cases of Guillain-Barré syndrome. One case was actually my friend, and he responded very well to the treatment. It will work. Scope of myasthenia gravis in homeopathy. I have one patient of myasthenia gravis, and he is responding very well to the treatment. Sometimes, if I have the video of this case, I'll definitely share the video, and you can see by yourself how the patient is reacting. See, sometimes what happens, either because of the rush of the OPD, every time we cannot shoot the case, or sometimes the patient does not want to be shot. So you have to believe me that I have a case and he is responding well to the treatment. Is LM 0/1 higher of impotency? Exactly, I don't know the Dr. Sarkar, the permutation combinations of the mathematical combinations, but it is said that LM 0/7 is equal to 1 impotency. Okay. Treatment. Yeah, the treatment, whatever I did was the patient. I basically see, it is a degenerative disorder. So something degeneration. So go to the mind and ask some syphilitic symptom to the patient. If you get a syphilitic symptom, prescribe on that symptom. I remember in that case, I think I had prescribed only on 2 syphilitic symptom rubric. I don't know the remedy, but next time I'll get you the remedy. Only on 2 rubrics I had prescribed. So it's 50 minutes. I can take one more questions before I leave. Anybody? 1 or 2 questions which I have missed out, or any question? Remedy for GBS. Whatever remedies which I have used is, first is Nux Omega. Second, you should use Trichinium Phos. Third would be Calcarea silicata. And fourth would be Kali Phos. Interesting cases, and I always tell to my friends, to my doctors, to my students, you can have a lot of knowledge of homeopathy, but you have to be lucky to get some beautiful cases in your OPD to treat. And if you're lucky sometimes to get beautiful cases, don't miss the opportunity to treat that case, because those cases give us a lot of confidence, a lot of confidence, a lot of happiness in treating those cases. So be lucky to have this. Approach in arthritis. Yes, so conium, yes, conium you can. I have never used conium, so I can that. But you have to be, I tell you have to be very lucky to get that. But I had not prescribed conium. I had prescribed that case, which was my friend's wife, Nux Omega in that case, and I went with Delim potency. And CON for GBS. You asking cause for GBS? I don't know. Dr. Babal is asking cause for GBS or CON. Conium, yeah. Conium for GBS. Yeah, conium for GBS. What doctor has said. Dr. Muzammil says Taj. I don't know what is Taj. So I think we're done with today. Thank you so much. Thank you everybody for joining. And if I miss some questions, you can always ask me on my next YouTube live. Okay, so everybody meet you on next YouTube live, or if you have personal questions, you can WhatsApp me. I'll try to answer in my spare time. Thank you so much. Thank you so much. Which rubric you must use for foggy mind? Let's put this question for the next YouTube, or tomorrow. I can answer this question, Dr. Alexandra, in our session of bi-monthly meeting. I have meeting bi-monthly, and surprise, and I think all doctors have put that advertisement, I should say, on the Facebook. And thank you so much. Thank you so much, Dr. Alexandra and Dr. I would say appreciable. Thank you.